Hey guys, it's Renaissance Man, and this is our third episode of Let's Talk Politics. Now, during the 2016 presidential debates, numerous voters were concerned about the rising costs of healthcare premiums under Obamacare, otherwise known as the Affordable Care Act. In order to fix this problem and address the healthcare crisis, we should make key reforms to the American healthcare system. I believe that we can do this without transforming our system into a single-payer system and giving the American people the option to choose their own insurance plan. This is because I believe that we should maximize the total amount of people that have health insurance, and we should strive for the goal of universal health care through a free market solution. If we remove the employer-provided medical care requirement, if we remove the employer-provided medical care option, it would reduce a huge burden on businesses. It would help businesses make more money, and in turn, it could potentially increase income for employees. For example, according to the Cato Institute, an employee is paid $40,000, and the company they work for pays $16,000 on medical insurance. Once we remove that employer-based medical insurance, the employee could gain a $16,000 wage increase. Also, once they pay taxes, they would have to pay an income based on a $56,000 income. This would lead to the government getting an increase in revenue from This would lead to the government getting an increase in revenue from that specific worker for approximately $2,400. Next, we should increase competition in the insurance market. This is because people cannot purchase health insurance across state lines. If we do not let people purchase health insurance across state lines, there will be a monopoly across all the states. In New York, for example, two insurers, GHI and Empire Blue Cross, represents and controls 47% of the market. Then the next step to do after that is to prevent consumers and citizens from being taken advantage of, and we should end the hospital practice of surprise medical bills. We should do this by protecting patients under ERISA plans, which is a plan that provides minimum standards for most voluntarily started pensions and health plans in private industry. In order to prevent even more consumers being taken advantage of by health insurance companies, we should continue to ban the rejection of applicants based on pre-existing conditions. However, we should encourage individuals to purchase health insurance when they are healthy. For example, like tax deductions on individuals who are healthy that purchase health insurance and maintain it for a certain amount of time. We should also modernize Medicare and Medicaid in order to prevent the fraud spending that both programs have used, and potentially allow the government to negotiate drug prices directly with the pharmaceutical companies. Then, we should allow companies to give consumers a chance to keep their plans before Obamacare. We should also eliminate repeated regulations that serve the same purpose. This would reduce the cost of healthcare on both the states and the federal government. You should keep the individual mandate that you must purchase health insurance. This is because if people aren't made to do something, they won't do it. In order to provide incentives for people to purchase health insurance, we should give people who purchase it while they're healthy a tax deduction in order to encourage them to keep the insurance. According to the Center for American Progress, if the individual mandate was to be removed, then the average premium would be increased by 27% in the year 2019. This is because people would wait to buy health insurance once they are sick. We should also allow individuals to customize their health insurance plan. This is because that is what both the Trump and Sanders supporters wanted. It would allow the market flexibility in providing people the insurance that they want. We should do this by including health savings accounts, which allows individuals to use their own money to make decisions about their health. We should also remove the middleman from the suppliers and the customers.